Question 181. A physician teaches a client about the need to increase her intake of calcium. So at the follow-up appointment, the nurse asks the patient which food she has been consuming to increase her calcium intake. So which answer suggests that teaching about the calcium-rich diet was effective? So option A, broccoli and nuts. Option B, yogurt and kale. Option C, bread and shrimp. Option D, beans and potatoes. So option B, yogurt and kale is correct answer. Question number 182. The nurse administered the dose of morphine sulfate as prescribed to a patient who is the post-anesthesia care, and the patient appeared to resting comfortably. So respiration rate is 8 and the oxygen saturation by the cannula is 86%. And the nurse should immediately administer which medicine? Option A, flumazine. Option B, midazolam. Option C, naloxone. And option D, ondansetron. So this patient is experiencing the morphine sulfate side effect. So naloxone is antidote of choice. Question number 183. During surgery requiring the general anesthesia and the patient heart stop and the carotid pulse is not palpated, so how many compressions per minute should be administered? Option A 50, option B 60, option C 80 and option D 100. So option D 100 is correct answer. Question 184. To decrease the incidence of aspirin of gastric content in the child hospitalization, so with the severe burn, and the nurse should position the head of the child. Option A, flat except during the meal, and option B, elevate the 30 to 45 degree during meal, and option C, elevated 15 to 30 degree for 12 hours after meals, and option D, elevated 45 degree at all time. So option D, elevate 30 to 45 degree during meal is correct answer. Question 185. A patient is having difficulty with cognitive ability after a stroke. So what part of the brain was most likely affected? Option A, midbrain. Option B, cerebellum. Option C, medulla oblongata. And option D, cerebellum. So option B, cerebrum is correct answer. Question 186. Following the lumbar surgery, a patient has a 4 millimeter surgical incision and the incision is clean and the edges are well appropriate, and this type of the tissue healing is classified as which of the following? Option A, primary intention. Option B, secondary intention. Option C, tertiary intention, and option D, superficial epidermal. So option A, primary intention is correct answer, because primary intention healing is the fastest, cleanest way of the wound healing. Question 187. Shrinkage device is applied after surgery for amputation of leg. So the goal of the shrinkage device is to form the residual limb into what shape? Option A, cone shape. Option B, oval shape. Option C, mushroom shape. And option D, cylinder with blunt end. So option D, cylindrical with blunt end is correct answer. Question 188. While caring for a patient in the post-anesthesia care unit, a nurse plans to keep the patient warm. So what is the most important reason for this action? Option A, to preserve the nutritional store. Option B, to prevent the cutaneous vessel dilatation. And option C, to decrease the patient anxiety. And option D, to lower the risk of infection resulting from chills. So option C, to decrease the patient anxiety is correct option. Question 189. A patient had a total abdominal hysterectomy 2 days ago and has not been out of the bed yet. So the patient is complaining the left leg pain and swelling. And what should the nurse do first? So option A, gently massage the patient legs. Option B, assess the patient pain level. Option C, assess the patient for Homan sign. And option D, instruct the patient to reflex the left knee and hip. So option C, assess the patient for Homan sign is correct option, because maybe patient is experiencing the sign of DVT. Question 190. During pre-operative preparation of a patient for amputation of left leg, the nurse has primary responsibility for option A, witnessing the patient's signature on consent form. Option B, explaining the procedure to the patient. Option C, explaining the risk of the surgery to the patient. And option D, making the appropriate incision line of the leg. So option A, witnessing the patient signature on the consent form is correct answer. Question 191. During cardiopulmonary resuscitation for a 75-year-old man in the emergency department, the doctor introduced himself as a leader for the CPR. So what is the most appropriate leadership style for this situation? Option A, autocratic. Option B, democratic. Option C, bureaucratic. And option D, laissez-faire. So in case of emergency situation, autocratic leadership style is most important. So that's why option A, autocratic, is correct answer. Question 192. Which of the following patient the nurse should see first? Option A, patient complaining of muscle ache and fever. Option B, patient scheduled for ECG. Option C, patient newly diagnosed with hypertension. And option D, patient with complaint of chest pain. So option D, patient with complaint of chest pain is our first priority. Question 193. A patient who has pain localized in the chest and now down to the left arm. So what is this type of pain we called? So option A, phantom. Option B, regimented. Option C, shooting. And option D, radiating. So option D, radiating, is correct answer. Question 194. A nurse has broken a medication vial by mistake. So what is the first action should nurse do? Option A, inform the head nurse. Option B, change the vial from the pharmacy. Option C, write a report. And option D, documenting the file. So option A, inform the head nurse, is correct option. Question 195. Which of the following vitamins is necessary for wound healing process? Option A, vitamin A. Option B, vitamin C. Option C, vitamin D. And option D, vitamin K. So option B, vitamin K, is correct answer because vitamin C plays very important role in healing process. Question 196. A nurse manager assign a task according to clinical competencies to the nurses. So which of the following is the management function? So option A, delegation. Option B, evaluating. Option C, planning. And option D, controlling. So option A, delegation, is correct answer. Question 197. A nurse manages preparing and writing a plan for dealing the disaster, code red. So which procedure is a top priority for the nurse manager to plan? So option A, infection control. Option B, staff orientation. Option C, patient education. And option D, patient relocation. So option D, patient relocation, is correct answer because code red almost always signifies a fire or the smoke, triggering the immediate staff action to rescue the people in danger. Question 198. A nurse manager includes staff in decision making process. So what unit structure is used? So option A, divisional. Option B, centralized. Option C, functional. And option D, decentralized. So option D, decentralized, is correct option. Question 199. A nurse checked the medication chart of a patient which has the following order: paracetamol 500 per oral QID. So how many times a day should the nurse administer the medication? Option A, once. Option B, twice. Option C, thrice. And option D, 4 times. So option D, 4 times, is correct option. Question number 200. Child has a 3rd degree burn of the hand, chest, face. So which nursing diagnosis takes priority? Option A, ineffective airway clearance. Option B, disturbed body image. Option C, impaired urinary elimination. So option D, risk for infection. So option A, ineffective airway clearance, is correct answer. Thank you.